Hello everyone, this is Dr. Hassanat. Welcome to my today's lecture. Today we will study about baroreceptor feedback regulation of blood pressures. Baroreceptor reflex, it also acts as a life-saving reflex in day-to-day activity. It also called pressure buffer system. So before going to a detail about baroreceptor mechanism, first, we should learn what is baroreceptors and where they are located and how they are stimulated or inhibited. Okay, let's see. Baroreceptors are stretch or spray type nerve ending and are sensitive to degree of stretching. So we can call it stress receptors. And this baroreceptor, they detect change in pressure in the blood vessels and chambers of the heart. Baroreceptors are abundantly present in the carotid sinus and in the wall of the aortic arch. Signals from the carotid baroreceptors are transmitted through the glossopharyngeal nerve to the nucleus tractus solitarius in the medullary area of the brainstem. And signals from the aortic baroreceptors in the arch of the aorta are transmitted through the vagus nerve to the same nucleus, that is the tractus solitarius of the medulla. A few baroreceptors are also present in the wall of the every large artery of the thoracic and neck region. So let's see detail about the distribution of the baroreceptors. In this figure, you can see this is the arch of the aorta, and here is the aortic sinus. There's a little dilated area, and the wall of this aortic sinus contains, these are the baroreceptors, and they are connected to the vagus nerve, and they send signal to the center via vagus nerve. And just above the bifurcation of the carotid artery, in the wall of the internal carotid artery, there is a dilated area called carotid sinus. This carotid sinus wall also contains abundant amount of baroreceptors. And here the baroreceptors are connected through the glossopharyngeal, that is ninth cranial nerve, and send signal via this nerve to the center. Okay, so here you can see for more detail about the carotid sinus. Here you can see just above the bifurcation of the common carotid artery, there is a dilated area in the internal carotid artery. This is actually carotid sinus and also contain these baroreceptors. So how these baroreceptors, they are stimulated? They are stimulated or inhibited? Actually, they are pressure receptor or stress receptor. So the increase in blood pressure causes distension of the carotid sinus and aortic arch, and they will also stress the baroreceptors. That will cause stimulation of the baroreceptors. Conversely, when the blood pressure decreases, this pressure decreases the receptor stimulations. That means these baroreceptors acts as a sensor that can sense the change of blood pressure. Either blood pressure is increasing or decreasing. So accordingly, it will send this signal to the center. Okay, so it is actually a sensor, acts as a sensor. They are stress spray type nerve ending. They can sense the change of blood pressure by sensing the degree of stretching during the change of blood pressure. Is it clear? Okay, so where is the centers for the baroreceptor feedback mechanism? The centers for baroreceptor reflex are medullary cardiovascular center, that is vasomotor center, and cardio-inhibitory center, that is actually nucleus tractus solitarius. Now, the key features of baroreceptor operations or baroreceptor mechanisms. Baroreceptors usually operates between a mean arterial pressure 85 to 115 millimeter of mercury. That means this is the set point for baroreceptor feedback mechanism. Okay, so here I have mentioned the set point in range, that is mean arterial pressure 85 to mean arterial pressure 115. But you may consider the average value, that set point is 100 millimeter of mercury mean arterial pressure. That means when the blood pressure exceeds or increase above this set point, baroreceptor mechanism will operate to bring the blood pressure down to the normal, or any other instances when the blood pressure tends to fall or decreasing, then this baroreceptor system operates to up the blood pressure to the level of normal set point, that is around 100 millimeter of mercury. Another important information I want to mention, when the mean arterial pressure drops below 60 millimeter of mercury, this baroreceptor regulatory system will be lost. Again, if any instances when this mean arterial pressure exceeds or increases above the 200 millimeter of mercury level, again the baroreceptor regulatory system will be lost. That means baroreceptor feedback systems operates between the 60 to 200 millimeter of mercury mean arterial pressure range. Is it clear? What is the range in between baroreceptor mechanism works? Okay, fine. Now, the physiological significance of the baroreceptor reflex. Here you can see this baroreceptor mechanism. It's a very fast neural mechanism. It is one of the major or important mechanism or short-term regulatory system of blood pressure. Okay, and it is a neural mechanism because I have already shown you. This is there is a neural center located in the medulla, and the signal pass through the nerve, vagus and glossopharyngeal nerve. So it is a neural and very rapid in actions. It can act within seconds. Okay, so it is a very fast neural mechanism. The second point, when the blood pressure falls, baroreceptor reflex operates within few seconds to correct the pressures, which is essential and life-saving in acute hypotension and acute hemorrhage. This is also life-saving in day-to-day activity. Okay. And it is also clear that baroreceptor feedback system stabilize blood pressure over a wide range of fluctuation in pressure between 50 to 200 millimeter of mercury. Some books mention this range 60 to 200, and some books mention the range 50 to 180 millimeter of mercury, but almost like that. Now, I have already told you this regulatory system, that is baroreceptor regulatory system, is also called the pressure buffer system because it can oppose, this mechanism opposes either increase or decrease in arterial pressure. Okay, so it is called a pressure buffer system, and the nerve from the baroreceptors are called buffer nerve. Is it clear? Fine. Another point, very important point, baroreceptor resetting occurs in chronic hypertension. I have already mentioned there is a set point for baroreceptor regulation, that is average or mean 100 millimeter of mercury. Okay, or in between the 85 to 115 millimeter of mercury. That means when the blood pressure increases above this set point, the baroreceptor feedback mechanism try to bring the pressure down to the normal set point, or any instances when the blood pressure is dropping from the set point, then the baroreceptor system operates to up the mean arterial pressure to the normal set point. But this response is normally executed during the acute change of blood pressure or rapid change of blood pressures. Okay, that means if any instances when any persons, in case of any persons that blood pressure remain higher for a prolonged period of time. That means in case of chronic hypertension, this baroreceptor set point, it will be resetted to a new level. So it will be elevated. In case of chronic hypertension, this normal set point is around 100 millimeter of mercury mean arterial pressure. But in case of chronic hypertension, this set point will be elevated to a new point. So that is why I have mentioned baroreceptor resetting occurs in chronic hypertension. Just similar like a regulation of temperature. You know, there is a set point for the temperature regulations. So sometimes this set point may be elevated, and then you will experience fever. So same thing happens. This set point, it will be resetted in case of chronic hypertension. So that means the baroreceptor is very much effective during the rapid change or acute change of blood pressures. Is it clear? Now, before going to discuss about the main scenario of baroreceptor feedback mechanism, we should learn some important things that are involved in the regulation of baroreceptor feedback mechanism, like the vasomotor center. I have already told you the center which regulate the baroreceptor's activity, that is called vasomotor centers, or another name, cardiac centers. And their location, they are located in the medulla oblongata, okay, or in the brain stem, that is medulla oblongata and lower part of the pons. So what is vasomotor center? It is a nervous center that regulates the blood pressure and heart rate. It is also called the cardiac center, and they are located in the medulla oblongata and lower part of the pons. There are actually different functional area located within the brain stem or in the vasomotor center, that like vasoconstrictor area. This vasoconstrictor area is responsible to produce sympathetic vasoconstrictor tone, and also produce the effect, produce the cardio acceleratory effect. It can accelerate the heart. Okay. Now the another distinct area called the vasodilator area, and this area actually acts indirectly. They inhibit the vasoconstrictor area, thereby produce vasodilatation and cardio inhibitory effects. So they don't act directly on the heart or on the vascular system. They actually act indirectly. They can inhibit the vasoconstrictor area and thereby affects the vascular caliber and cardiac acceleratory effects. So they can inhibit the heart, thereby decrease heart rate and decrease force of contractions. Another area located in the vasomotor center, that is called sensory area. So the functions of sensory area is to receive signal from 9th and 10th, that is glossopharyngeal and vagus nerve, and control the activity of the vasoconstrictor and vasodilator area. By this time, we are already known what are the functions of vasoconstrictor and vasodilator area. And this sensory area also send excitatory signal to dorsal motor nucleus of the vagus and the nucleus ambiguous, thereby increase the parasympathetic tone. Okay. So they are actually called cardio inhibitory center or center for parasympathetic system. So here is the cardio inhibitory center, consists of nucleus tractus solitarius, dorsal nucleus of the vagus, and nucleus ambiguous. So these are the different functional areas located in the medulla oblongata and pons or in the brain stem. They are involved in regulation of blood pressures via baroreceptor feedback system. Another important term we should know, that is what is vasomotor tone. Actually, basically there is a continuous sympathetic discharge from the vasoconstrictor center, producing a constant partial state of constriction of the blood vessels. This is called vasomotor tone. So what will happen if there is any change in vasomotor tone? If the vasomotor tone increases, that will constrict the blood vessels and reduce the caliber of the vessels. And when this vasomotor tone decreases, the vessel, it will dilate. That means increase the caliber of the blood vessel, and thereby it can regulate the peripheral resistance and also blood pressures. Now here you can see the actual scenario of baroreceptor feedback mechanism. Say the blood pressure is dropping, your blood pressure is increasing. So what will happen? Normally, in response to increased blood pressures, main response is produced by aortic baroreceptors. Okay, so what will happen? It will, this elevated blood pressure, it will causes distension of the aortic sinus and carotid sinus. But predominantly this response, it will be produced by the aortic baroreceptor. I just mentioned. Okay, so what will happen when there is a distension of the this aortic sinus? The baroreceptor, it will be stressed, that is located in the wall of the aortic sinus, and become stimulated, and this increased degree of stretching, this signal, it will be transferred to the center, that is in the nucleus tractus solitarius located in the brainstem. So what will happen? That will stimulate the nucleus tractus solitarius, and that informs the vasomotor center that blood pressure is increasing. Please do something. So what will happen? From this sensory area, your blood pressure is increasing. So you want to resist this elevation of blood pressure. So what you want to do? There is two centers, cardio-acceleratory center and cardio-inhibitory centers. Cardio-inhibitory center, it is actually the vagal center. And stimulatory area, I have already told you, that's the vasoconstrictor area. So if you want to resist this elevation, you have to stimulate the cardio-inhibitory area, that is the vagal center. So what will happen? In response to elevated blood pressure, there will be activation of the cardio-inhibitory area or activation of the vagus nerve. Okay, because through the nucleus tractus solitarius, I have already told you, that sends stimulatory signal to this vagal center, that is dorsal nucleus of the vagus and nucleus ambiguous. So what will happen if the vagal activity increases? That will decreases the heart rate and decreases the cardiac output. In the other hand, the vasomotor center, that will be inhibited, especially the vasoconstrictor area that produce the vasomotor tone, that will be inhibited. So what will happen? If the inhibition of the sympathetic outflow, that will cause decreased myocardial contractility. And again, it contribute, this decreased myocardial contractility will contribute to decrease the cardiac outputs. At the same time, due to this reduced sympathetic tone, there will be a vasodilatation and thereby reduce the peripheral resistance. So the ultimate result is decreased blood pressure. So that is how, when there is an acute elevation of blood pressure, baroreceptor feedback mechanism operates to bring the factor down to the normal set point. That is the mean arterial pressure, 100 millimeter of mercury. That is the normal set point. Okay. So what will happen? This is the response when the blood pressure is increasing. Okay. Now the opposite thing may happen, because you know baroreceptor feedback mechanism not only operates in response to increased blood pressure, it also opposes the fall of blood pressures. So this is a reverse action. Okay, let's see what happens. Normally in our daily life, during the change of posture, here you can see the blood pressure falls by about 30% on standing from lying postures. So this is very dangerous. If your blood pressure suddenly fall by 30% due to the sudden change of posture from lying to standing, this acute fall of blood pressure, this may cause shock. But do you think Do you face the shock? No. Thanks God, there is a baroreceptor feedback mechanism which is immediately corrected by the baroreceptor reflex. So here is the scenario or mechanism how this baroreceptor feedback mechanism prevent the acute fall of blood pressure or prevent the shock during the change of posture from lying to standing. So what will happen? Here you can see, say your blood pressure is dropping during the change of posture, or any instances when in case of acute hemorrhage, due to sudden loss of significant amount of blood, your blood pressure may fall. Okay. Then what will happen? When the blood pressure falls down, there will be less stretch on the carotid sinus. Another point I want to mention, when the blood pressure is dropping, the main role is played by the carotid sinus baroreceptors. Okay, so during the elevation, the predominant role is played by the aortic baroreceptor, but when the blood pressure is falling, the carotid baroreceptors play the vital role. Okay, so what will happen? There will be less stretch of the carotid sinus baroreceptors. That means degree of stretching, it will decreases. So this decreased degree of stretching, this signal will be transmitted to the nucleus tractus solitarius via the glossopharyngeal and vagus nerve. So what will happen? Now this sensory area, that is the nucleus tractus solitarius, is less stimulated. That means your blood pressure is falling. So what to do? If your blood pressure is falling, what will happen? There are two important areas, cardio-acceleratory area and cardio-inhibitory area. Now you have to inhibit the cardio-inhibitory area. That is, you have to inhibit the vagal activity, and you have to enhance or stimulate, or you have to activate the vasomotor center. That is mainly the vasoconstrictor area. So what will happen? Due to inhibition of the vagus nerve, heart rate decreases, and thereby, if the vagal activity decreases, that means heart rate increases, because normally vagus nerve decreases heart rate. So when there is an inhibition of the vagal center, your heart rate increases. So that will ultimately increase cardiac output. Okay. In the other hand, due to activation of the vasomotor centers, that means it will increase the sympathetic tone. So if the sympathetic tone increases, what will happen? It will increase the myocardial contractility and thereby increase the cardiac output. In the other hand, this vasoconstriction, that will increase the total peripheral resistance and thereby ultimate result in increase or elevate the blood pressures. So that is how baroreceptor feedback mechanism oppose the fall of blood pressures during acute hemorrhage or during the sudden change of posture from lying to standing. Is it clear? That means baroreceptor feedback mechanism operates in both directions. It can oppose the elevation, and it also can oppose the fall of blood pressure. That is why it is called pressure buffer system. So now the example of the baroreceptor mechanism, there is the example Valsalva maneuver. The integrity of the baroreceptor mechanism can be tested with the Valsalva maneuver. Okay. So how will you perform this Valsalva maneuver, or how you can test it? Here you can see that expiring against a closed glottis causes an increased intrathoracic pressure. When the intrathoracic pressure increases, that will decrease the venous return. If the venous return decreases, that will ultimately causes the decrease in cardiac output and arterial pressures. Okay. Now what will happen? The next, if your baroreceptor reflex mechanism is intact, this decrease in mean arterial pressure is sensed by the baroreceptors. leading to an increased sympathetic outflow to the heart and blood vessels. So in the test, an increase in the heart rate would be noted. Okay, you can note your heart rate increases. Now, when the person stops the maneuver, that means now the glottis is open. So what will happen? Your intrathoracic pressure decreases, so venous return increases. Now the cardiac output also increase the cardiac output and mean arterial pressures. The increase in mean arterial pressure is sensed by the baroreceptors, which direct a decrease in heart rate. Okay, so this is a very simple way you can test the integrity of baroreceptors feedback mechanism. Now the last thing I want to mention, if there is a section, a resection is made in the baroreceptor nerve, so what will be the effects? Actually, the ultimate result, there will be acute type of hypertension, and this is called neurogenic hypertension. Suddenly, mean arterial pressure to increase from 100 is a set point, but when the baroreceptor nerve is resected, so it will become high to as high as 160 millimeter of mercury. But the interesting thing, this pressure returns to nearly normal within about 2 days. Okay, how? Actually, because the response of the vasomotor center to the absent baroreceptor signal fades away. So initially, when there is a no signal coming from the baroreceptor, now the vasomotor center become excited and increase the vasomotor tone and thereby increase the pressure. But when after 2 days, this this vasomotor center sensitivity, it will decrease or fades away. So which is called central resetting of the baroreceptor pressure control mechanism. And now your pressure will come down to the previous normal conditions. Okay, so it will cause a acute hypertension, not chronic. Okay, and this is called neurogenic hypertension. Thank you very much.